What will be the impact of affordable care now after being supported by the Supreme Court in yesterday's ruling? We're joined now by Dr. Sreedhar Potarazu, the CEO of Vital Springs Technologies, and Grace Marie Turner, president of the Galen Institute, promoting free market ideas for health care reform. Good to have you both with us. Dr. Potarazu, let me ask you this. The decision is now in place. Obamacare, as it's been laid out now, what will be the impact, do you think, on the medical profession, more importantly, on patients?
The impact to the medical profession, Lou, is going to continue to deteriorate in that the current mechanics have forced insurance companies to try and gain greater market leverage. They've started buying up a lot of hospitals, a lot of practices, so that physicians have less control. They're essentially becoming employees of these larger networks, which means that they're going to have less say. From the patient's perspective, the consistent trend of costs going up isn't going to change. The premiums have gone up since the law has been enacted.
Right.
We all know that if the consumers, the average American consumer that's listening today, was told that this was going to be a tax, that we wouldn't have a law today, and that the underlying economics of what we're forcing the American citizen to pay is unacceptable, because the underlying financial assumptions in this law are completely flawed, and nobody can refute that.
Grace Marie,
and so,
I'm sorry, Doctor. Grace Marie, these economic assumptions, are they so onerous that we're going to see some curtailment of services, or are we simply going to be shifting all of these, increasing costs onto the government, onto taxpayers, and what this means right now is onto future generations of Americans through our national debt?
Well, first of all, the underlying assumptions of how this law was allegedly paid for, remember, it's supposed to reduce the deficit, were flawed from the beginning. And, for example, they say we're going to have $500 billion in cuts to Medicare. Well, every time the trigger point comes to, for example, cut doctor fees by 30%, the Congress overrides it. So it's not going to work from that perspective. More and more costs are going to be shoved onto the private sector, and yet the Secretary of Health and Human Services has already been using her power to try to jawbone health insurance companies to keep those prices down. At some point, you can't artificially use price controls to keep the cost down, while you are at the same time demanding that the policies cover more and more procedures. In this long list of preventive care procedures, for example, that are supposed to be free to patients. Well, where does that show up? It shows up in higher health insurance premiums. Wait until we see the mandates on what the long list of benefits that have to be covered. We're really going to see all the efforts to keep prices down from the top and all the pressures for prices to come up from the bottom. And yes, I think that's right, that we're going to see doctors leaving the profession in droves.
Dr. Potarazu, the estimates are that we're going to be 15,000 physicians short here in the next couple of years. What's your reaction? What are your thoughts on what looks to be a building medical crisis in this country?
of course it is, Lou. We have a supply and demand issue. We've just now increased the number of patients that can access the system. We don't have the supply of doctors that can actually provide care to these individuals. So at some point, the system is going to start bursting at the seams. If the average time for a patient visit today is 7 minutes, and maybe it's even less, and the existing system is required to absorb that excess demand based on this proxy for coverage, then of course you're going to have to take on more patients. The amount of time that an individual gets with their doctor will be much less. And guess what? Mistakes are going to be made. And so the whole notion that coverage is a proxy for care is completely misleading the country in saying that just because the uninsured get care doesn't mean that you're getting a blank check and that you will get everything covered. And I don't know how much the American public really understands this.
And to that point, Grace Marie, no one knows more than you do about the the economics and the impact of this, and politically, we're strained for time here. But give us your assessment as to how important affordable care, Obamacare, will be in the campaign, or is this a done deal? Move on.
Oh, you know, I think the American people thought the Supreme Court would rescue us from Obamacare. They didn't like it from the beginning. The more they learned about it, the more they didn't like it. But now we're all going to have to learn what's in this law, because I believe it's going to be the major issue going into the fall campaign, and the president cannot help but be unhappy about that. The centerpiece of this law has now been called a tax, and it is the most unpopular provision, the individual mandate. People are going to start to, I think it's going to be a huge motivator for people to go to the polls, because that's their last resort to stop this from going into place.
Grace Marie, thank you very much for being with us.
Thank you, Lou.
Dr. Potarazu, thank you.
We
appreciate it.